We know a lot about COVID-19 by now, right? And we are learning more and more every day. This is a new disease. There is still so much new information that is being revealed on a daily basis. But something that I think needs a little bit more focus, a little bit more attention is, what about after you get COVID? What happens after I go through a treatment and recover and come out on the other side? Do things go back to normal? Because let me tell you, from my personal experience, they don't. The after effects are still lingering. And to tell you more about these issues and how to tackle them, we have our expert today, Dr. Jayalakshmi, MBBS, MD, consultant, pulmonologist, going to shed more light on this topic for us. So welcome, Dr. Jayalakshmi, and we'd love you to share a little bit of knowledge and something about the new rehabilitation program. And as one of the first questions and one of the most important questions, what are the lingering effects of COVID post-recovery and how long do these effects last?
Many patients don't have any lingering effects at all. So those who get very mild illness, they just recover and they are through and they feel fit and fine. This may be up to 40 to 50% also of the patients who have suffered from COVID. But there are those who have lingering effects like mainly loss of smell, loss of taste. They may have a feeling of muscle pains, body pains, weakness. They may have hair fall. They may have something like night sweats or feeling feverish and feeling sweaty, and this may come suddenly, like they're feeling fine for about 10-15 days and then suddenly they get feeling chilly or feeling feverish. It settles by itself. So these effects are there. In some few patients we see that they really get high fever again after maybe 2 or 3 weeks, and sometimes even we have to readmit them and they may need to be treated. Often we find there's nothing else. Some patients post-COVID, because of the loss of immunity or maybe because of the treatment of steroids which they have got, or because of the weakness, they develop other infections. Like commonly we are seeing urinary tract infections. So these are the common post-COVID symptoms what we see.
I know that this is COVID-19 is almost a year old. How long does it last? I mean, these effects, how long have you seen that these last?
So most of the patients, they recover from, even those who are having these post-COVID effects, they recover within about 6 weeks. They are through these effects also and they are feeling fit and fine. The main problem we are seeing is those who have had lung effects. So those who have had lot of lung fibrosis or lot of lung involvement, or who have been in the ICU for a long time, or who have been on ventilator, these are the patients who have long-standing effects which may last for 6 months. We have been seeing from March, so we are seeing that the patients are still coming back to us with the lung problem. So these are the significant percentage of the people who have lot of illness for long time, are those who have had severe lung problems, or who have been in the ICU for a long time, or who have been ventilated. Few patients we see who have got blood clots, like in the brain we call it a stroke, or who have had a heart attack after the COVID illness because of the increased blood clotting, or clotting in other places as well. We have seen patients with fingers which have clotted and hence got gangrenous even requiring amputation. So these are few of the long effects which we see which are not good. But most of the patients recover within 6 weeks.
Doctor, why do you think it's important to have rehab post-COVID?
So many of the patients after the COVID infection, they have a lot of weakness, and this weakness may be muscular weakness. Many of them have psychological effects because there is a stigma still associated with the illness. Many of them are hospitalized, and the hospitalization is bad because of the isolation that they have to undergo. Even though the health workers are there, they are in their PPEs, and the patient doesn't really you can't have a relative along with them. So these things make it really difficult in the isolation phase. After they come home, it has been a significant psychological trauma which they've been. Fortunate are those who have been only home isolated, but even in the home isolation, they are in a room, they are not able to come out. The family, they are scared that their family can get infected. So these things have a lot of effect. And so post-COVID rehab has 2 or 3 aspects mainly. One is the psychological aspect, where you have a psychotherapy, And one is the physical aspect where you have a physiotherapy, and one is the nutritional aspect where you look into exactly what they can eat and what are the healthy diet for them, and
Sure.
then is the medication aspect, which
Sure.
depends on the type of illness they've had during the COVID.
Sure. No, I absolutely understand, because I was in a room by myself for almost 16 days and with almost zero human contact. And it can take a toll, and there is a lot of stigma around it, which is, I think, which is really not appropriate.
Not called for.
It's not called for at all, and because it's from what I know and what I've learned, it's just a virus, and it's something that anyone can have, and which goes. And I also feel that yes, over time, even today when I meet people, they ask me if I'm okay, because they think that it could have been something worse. Doctor, how long would a person be required to undergo this rehab program?
So the duration of rehab program will depend on what kind of illness the patient had actually. If it's a very mild illness, or if they've had more of they have had problems because of the isolation, or and they have recovered physically, they would need more of counseling. Should be enough for about 1 month or 2 months before they get back to their daily life. But if they've had more serious illness, like if they've had significant lung involvement, the rehabilitation program, or if they've been in the ICU for a longer period of time, weakness of the muscles, so this will require a prolonged rehabilitation program, maybe 6 months, maybe up to 1 year. Maybe the intensity of the rehab program itself, they would learn twice a week, or maybe once a week, thrice a week, and continue it at home on their own. Or once they learn, they can continue. But the physical exercises, the dietary changes, this would be recommended to continue by themselves once they're finished.
So doctor, one last question. What does the post-COVID rehab program consist of?
So basically, we look upon 3 aspects. One is the mental aspect, where there is a psychotherapist who counsels the patient, and they have weekly or bi-weekly sessions depending on what is required. Secondly, there is a dietitian who looks into the nutritional requirement of the post-COVID patient and gives the therapy what is required. And third is the medical evaluation, where we evaluate mainly the entire physical, the tests are done, the medical tests are done, and also the pulmonology, the neurology, and the cardiac consults or evaluations are done, because these are the illnesses which are commonly affecting the post-COVID patients. So in lung, we see the lung function testing. We make the patient walk and do a 6-minute walk testing to see the oxygen saturations. We may re-evaluate with an X-ray or a CT scan as required. And importantly, the patient will undergo a physiotherapy for muscle training, endurance, as well as aerobic training to improve the physical capacity. So these will be the main components.
Great. Thank you so much, doctor, for the insight and for all the information that you've given us. And I'm sure it's going to help all our viewers and everyone who needed this help and had all these questions. Thank you. So there you go, folks. Now you know how important it is not just to take care of yourself during the process if unfortunately you get infected by COVID, but also just how important it is for everyone to take care and look after themselves post-COVID recovery. We hope that our experts' advice has been helpful to you all and goes a long way to get you back on the road of recovery. Take care and stay healthy.